now you'll see that there's this area right here. This is actually where the ilium joins to the sacrum. And when it actually joins to the sacrum, it forms this area right here called the iliosacral joint. So that's what that is, the iliosacral joint, where the sacrum joins to the ilium. Right here. Okay. Now, right after the iliosacral joint, right here, this is what is called the arcuate line. Okay? That's what this is. This is the arcuate line. You can see it forming an arch or a curve, kind of an arc. And that's why it's called the arcuate. Okay? And that's what that is. It's the arcuate line. Okay? And then you got the pelvic rim coming across like that. Now, are y'all good so far? Okay. Now, as we move towards the front, like this, we'll see that we have this area here associated with the pubis. Good job. A musical interlude. Thank you very much. All right. So here we have this region here called the pubis. Now, the pubis has a superior ramus and an inferior ramus. So this is the superior ramus of the pubis, and this is the inferior ramus of the pubis. Okay? Superior ramus and inferior ramus. Okay? Now there's a bump on the side right here of the pubis, right in this area here, and this would be the tubercle. Okay? It would be the pubic tubercle, right in this area right there. Okay? And then of course you have the pubic crest or ridge, which would be up here. Okay? Right there.
Where's the tubercle?
Huh? It would be right here on the outside, right there. Now, what you would see as far as the inguinal ligament, and you'll see that on this model here, you'll see a ligamentous tissue running down between the anterior superior spine, iliac spine, and that of the pubic tubercle. So you'll see it coming down like that. And in fact, let me show you that. And that's this right here. And that's again the inguinal ligament. Inguinal ligament. Okay. The anterior iliac spine, which is here, anterior superior iliac spine, and that of the pubic tubercle. Okay. Now, this area right here, where the two pubic bones would actually end up meeting, is the area where the pubic symphysis would actually be found, right in this area here. And the pubic symphysis is a symphysis, which means it has cartilaginous tissue in between, and it has articular cartilage at the ends of the bone, and then ligamentous tissue holding it all together. And of course, the tissue type that would be found in a pubic symphysis would be fiber cartilage. The same type of fiber cartilage that would be found in between the vertebrae, basically in the intervertebral disc, as well as in the meniscus of the knee. Fibro cartilage. The pubic symphysis? Yeah. All right. Now, the superior ramus and the inferior ramus of the pubis helped to form this opening right here. But the other structure, of course, that helps to form the opening is this area right here underneath, right here. And this is, of course, the ischial ramus. This is actually a part of the ischium. So here's the ischial ramus right here. Okay? So
right after the inferior ramus?
So right after the inferior goes down like that, and then this goes across like that.
Okay.
And so the one that goes across is not the inferior ramus, it's actually the ischial ramus. Now, the opening that forms as a result of the three rami and of course this, the acetabulum is here and the issue tuberosity is here. We'll talk about that in a second. The opening here is the obturator foramen. Obturator foramen. And there are a couple of things that are going to be very important in identifying or associated with the obturator foramen. Obviously, the obturator artery, you're going to need to be able to identify, as well as the obturator nerve. That's also going to be important to identify, especially associated with the sacral plexus. And we'll talk about that a little bit later on. That good so far? Mm-hmm. Superior pubic ramus, inferior pubic ramus, ischial ramus. Okay, good. And then obturator foramen. Right, the big hole. Now, the ischium, the ilium, and the pubis all come together to form this depression right here. And this depression here is where the head of the femur would actually fit in. So, this is, of course, the socket in the ball and socket joint. And so this is called the acetabulum. 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 A-C-E, tab, T-A-B-U-L-U, tabulum. Yeah, it's the depression right here. Okay? And that's the acetabulum. Got it good so far? Mm-hmm. All right, we're going to turn this towards the back a little bit, and you'll see that there's this large roughened area right here. Large roughened area right here. This is actually what's called the ischial tuberosity. Mm-hmm. Okay? So this is where a muscle attaches to the ischium. And so this is called the ischial tuberosity. Okay? And then you'll see off to the side, right here, this little piece that sticks out. And that piece that sticks out is a spine associated with the ischium. So this is the ischial spine. Okay?
God,
So this right here, ischial spine. Now, this is very important because the ischial spine actually separates two depressions or notches. There's a notch above it and a notch below it. The notch above it is larger, so it is the greater of the two notches. And the one below it is a smaller one, so it is the lesser of the two notches. Now, the notch, these notches here are designed to actually allow the nerves that run in this posterior direction to come out. And of course, the nerve that runs through this region is, of course, the sciatic. So this is called the greater sciatic notch, and this is called the lesser. So the greater is at the top, and the lesser is at the bottom. Greater sciatic, lesser sciatic. Lesser, greater, lesser. Okay, y'all good so far? Mm. All right, now there are also gluteal lines that run across here. You're not going to be able to see it on this plastic one. It's basically where the other gluteal muscles attach. And so you're not going to see it here, so you just have to imagine that they're here. Okay? So don't worry about it though. But you just need to know that they're there, okay? Mm-hmm. All right, y'all look good?
Yeah.
All right, so that is the os coxa. All right? So this one's fairly detailed, so there's a lot of information on here. This one's kind of detailed, just kind of as